Welcome back here at 8:17. Between the pandemic and the anti-vaxxer movement, vaccines are a hot topic. Each year, about 50,000 people in America will die from diseases that can be prevented with vaccines. Dr. Brent Wallis of People's Health joins us to dispel some of the myths surrounding vaccines. Good morning, Dr. Wallis. We appreciate you joining us.
Thanks for having me.
So tell us about, well, I know one of the biggest vaccines that people are talking about constantly because we are in this COVID-19 pandemic is the COVID vaccine. Where do we stand as far as that vaccine is concerned?
Yeah, it's a very hot topic right now, obviously. There's over 20 manufacturers that are furiously trying to complete a vaccine, get through all the trials and release it. It's more likely that we're going to see that coming in 2021. Because it's going to take quite a while to vaccinate all those people. So what's really important right now is, maintain social distancing, wear your mask, wash your hands, and really right now get your flu shot because they're available and we should go ahead and do that now.
Before we get to the flu shot, back to the COVID vaccine, I know the timeline is kind of confusing for people. I know in a trial situation, the biggest thing is that children cannot be a part of the trial. So is that part of one of the many issues kind of prolonging us getting this vaccine out for the masses?
Yeah, definitely. Usually for kids, we don't do those trials to start with. And so that's going to be in a later phase of this. So when the vaccine does come out, it's really going to be made available probably to first responders and people that are high risk.
And then other people and kids would be coming later on down the line. In the meantime, though, there are lots of vaccines out there that can prevent other illnesses. Can you walk us through some of the vaccines? You mentioned one, but walk us through some of the vaccines that people can and maybe should be looking into now.
Yeah, there's a whole bunch that people don't always think about, but we still have a lot of problem in colleges with meningitis, and so there's a vaccine for that. Hepatitis, actually A, which we've had an outbreak of here recently, but there is a vaccine for hepatitis A and hepatitis B as well. And then people should definitely be getting their booster shots from some of the vaccines that they received when they were younger. Things like a Tdap, which includes tetanus, and pertussis. Pertussis is whooping cough, and that can actually be very dangerous in pregnant women. So getting revaccinated is important as well.
And we have a couple seconds left here. I know people sometimes worry about getting all those vaccines, getting booster shots, because they may make them feel sick. What are your thoughts on that?
Yeah, vaccines don't have live virus in them, and so that really is not something that they need to worry about. Occasionally, you'll get a local reaction, maybe a little soreness, even a low-grade fever, but it's definitely not related to the virus that you're taking the vaccine for.
All right. Thanks so much, Dr. Wallis. We appreciate your time.
Thank you.